About a year ago, we had a client named Timmy come into our office. We are recording these interviews for educational purposes to help patients with similar diagnoses.
Hi, Timmy. As you've been informed earlier, the camera is now running, and we're going to use this interview for educational purposes. And if at any point you feel uncomfortable, feel free to tell me to stop. Okay, so let's begin. So my name is Dr. Sneeden. Can you tell me what brings you in today?
First, don't call me Timmy. My whore of a mother gave me that name. Call me Drakkar.
Okay, Drakkar. Why are you here today?
I hate my life, and I just wish I were dead. But the only reason I'm here is because Chuck's mother made me come.
And can you tell me who Chuck is?
I've never had a friend until Chuck. He understands my life.
Can you tell me how you met Chuck?
We met on a web chat. We instantly connected, and I moved into his house right after visiting him on vacation.
And can you tell us where you lived before you moved in with Chuck?
With my grandma, but she never came after me, so clearly she doesn't care about me that much.
And have you talked to her at all since you've left?
No, I love her. I mean, she's the only person that ever cared for me. That's why it hurts so much. I can't talk about this right now.
That's okay. Let's continue with another topic, but we'll come back to that when you're ready. Let me see here. Can you tell me a little bit about your medical history?
Well, Chuck's mom thinks I'm autistic, but I know that's not true. I mean, it's not my fault. It was my drunken mother's fault. She's the one that gave me fetal alcohol syndrome.
I can see you have some strong words to say about your mother. Are you still in contact with her at all?
Hell no. She let her boyfriends beat me from the time I was 6 years old. She abused and neglected me. I got out of there as soon as I could.
Do you have any other family members you're in contact with?
My grandma's the only person I know. She took me in when I was 16. No clue who my father is. He's alive, that's about all I know. Thank God I had no other siblings that my mother could beat.
So that sounds like a lot. And how do you cope with all this?
Smoking pot gets me through it. And I don't really like talking to regular humans. I'm a furry, if you know what that is. I like to wear animal skins when I go out. I only talk to other furries.
Well, if it makes you more comfortable, for our next session, you can feel free to wear your skins.
Oh, I was hoping that you would say that.
Okay, great. So I think we're going to end the session there, and I look forward to seeing you again on Tuesday.
Okay.
From our first clinical interview with Timmy, we learned several important pieces of information that affect his diagnosis. Firstly, it is evident that Timmy is suicidal. He has demonstrated the ideation for killing himself, and we must look deeper into it if he possesses the plans and means for suicide. Secondly, Timmy clearly has relational problems with his family. He demonstrates a lot of resentment for his mother. We suspect that this may be the source of many of the problems that Timmy is facing. Thirdly, Timmy was abused as a child. Research tells us that childhood abuse is a risk factor for many abnormal disorders later in life. We expect that childhood abuse is significantly affecting his current relationships and outlooks on life. Fourthly, Timmy has unresolved problems with his grandmother. This presents an opportunity to address these problems in later therapy sessions. Fifthly, Timmy engages in recreational use of THC, and we later learned that he may overuse opiates. We expect that his drug use is his method of self-medication to relieve stress, anxiety, and depression. Finally, Timmy's social interactions are minimal. Most of his social engagement is done online, and the few relationships he has in person are with Chuck and Chuck's mother. We examined these relationships further in therapy. Taken together, the information we gathered from our clinical interview helped determine our diagnosis and therapy treatments most suitable for Timmy. Based on our clinical interview and later therapy sessions, we determined that Timmy's diagnosis is as follows. Depressive disorder due to a medical condition, which in Timmy's case is fetal alcohol syndrome, or FAS, mild autism spectrum disorder, and substance abuse disorder for his use of opiates and recreational marijuana. Here are the F&B codes for our diagnoses. For instructional purposes, the remainder of this video will focus on treatment targeting Timmy's depression and substance abuse. This next session is 1 month after the first session. Timmy has gotten a little more comfortable with the therapist, and here we will introduce Chuck and his mother, who is Timmy's current caregiver.
Day 2.
Hi, Drakkar. I see you're wearing your furries today. Is that new?
Yes, I actually just got it. Chuck helped me pick it out.
Well, hi, Chuck. It's nice to finally meet you in person. Thanks for agreeing to come out and for allowing the session to be recorded. I understand that this isn't an easy situation for you.
It wasn't. But my friend means the world to me. I would do anything to help him. This is my mother, Cindy.
It's nice to meet you too, Cindy. There's been something I wanted to bring up between the two of you. Drakkar's told me that you've been calling him autistic. Is there any reason in particular for this thought?
I don't mean to offend him. I just truly think he is autistic. I know some friends of mine who have children who are autistic, and Drakkar just reveals some similar qualities. I've taken him as my own son, and I just want the best for him.
Thank you for explaining that. Drakkar's told me before that he feels as though he's not on the spectrum, and that he feels just as normal as Chuck is. Now, do you feel as though Chuck is also on the spectrum?
We're here for Drakkar, not for my son.
I'm sorry, I didn't mean to make you feel uncomfortable. I'm only trying to understand the situation a little bit better. As I said, Drakkar feels as though he and your son are very similar, and despite the 10-year age gap. So I'm just trying to understand and to learn if the autism is also a similarity between the two of them.
My son is not autistic, and we're here for Drakkar. If you're going to try to tell me that my son has something wrong with him, I'm just going to excuse myself for a minute.
Okay, we're going to continue on with the session. Let's give Cindy a minute to cool down. While Cindy's out of the room, I'd like to take this time to bring up an important question I've had between the two of you. I understand that you met on a web chat and became instantly close. Drakkar, do you have any romantic feelings towards Chuck?
I'm not really sure. I have one family, and that's Chuck. I can't really tell the difference between relationship love and friendship love. I'm young and I've never had sex with Chuck or anyone else, so I honestly can't really answer your question.
And I love Drakkar, but I don't think we need to put a label on us. It's a special relationship to the both of us. Why does everyone feel like they need to be involved?
I'm only asking because I understand that both of you are close. I didn't exactly understand how the relationship was defined between both of you.
Well, it's not sexual, so define that however you want to.
Hi, Cindy. Welcome back. How are you feeling now?
Fine. Are you done talking about Chuck? I'd just like to focus on Drakkar.
Yes, back to Drakkar. So, I wanted to talk about your living arrangements. It was nice of you to welcome him into your home.
Well, it had to be done. He had a better relationship with us than with his grandma or his mom.
Yes, he's indicated that to me. He moved out of his grandmother's house to move in with you, correct?
Yeah, and she's never bothered to come up after him. That's why I'm glad he loves us like we love him. He's a second son to me.
That's very nice of you to say about Drakkar. Thank you for clarifying all of that to me. It was great of both of you, for both of you to come out to the session today. I'll keep both of you updated. Next, I plan to contact Drakkar's grandmother to see if we can get her to come out to a session, and I'll let you know how that goes. But we will stay in touch, okay? So thank you again, and I'll see you guys soon.
Our next scene will be a similar session. However, it will include the therapist Timmy and his grandmother. We hope to address any unresolved problems between Timmy and his grandmother. Note that in this session, the grandmother will refer to Timmy as Timmy instead of Drakkar. The therapist will still be calling him Drakkar, as he expressed that this is the name that he wishes to be called by.
Day 3.
Hi, Drakkar. Welcome back. This is your grandmother, I suppose?
Yes, this is my grandma.
Hi, Dr. Sneathen. It's very nice to meet you finally. Timmy, why do you insist on being called that silly computer name of yours? Timmy is such a beautiful name.
I don't want to be associated with my whore mother. Drakkar is who I am.
Sweetie, it's such a beautiful name.
I won't respond to the name Timmy. Too many bad memories. Please just accept it, Grandma. Everyone else does.
Whatever makes you happy. I only want what's best for you.
I'm sorry to interrupt here, but that comment brings up a point that I'd like to discuss with both of you. Drakkar indicates that you haven't cared much about him recently, and you didn't follow him after he left your home. Is this really the case?
No, I love my Timmy. I'm sorry, my Drakkar. As I said, I only wanted him to be happy. Because he left home, I figured that's what he wanted. I do wish I had been invited to meet his new friend Chuck, however.
But, Grandma, you never even tried to contact me. I could have been dead and you wouldn't have even known.
I do suppose I should have written to you more or tried to call. I just didn't want to interrupt your new life. You know how much you mean to me.
Drakkar most certainly does love you. He said only good things about you in the past, and he's even said that you're the only person he considers to be his family. Have you been in contact with his mother at all?
Oh, not in quite some time. She used to check in occasionally while Drakkar was still living with me, but once he moved out, she checked out. I think she's with a new guy now. I never can keep track.
It's because she's a slut. I'm glad I don't have to meet that man.
That's all right, Drakkar. I don't want you getting upset about your mother. We're trying to focus on you making amends with your grandmother right now. You two always seem to have a really great relationship.
Drakkar, I miss you so much. The house is so lonely without you. I understand you might not want to move back in with me, but it would be nice if you'd visit occasionally. I want to stay in touch with you, stay updated with your life.
So, how would you feel about coming to visit Drakkar at Chuck's home? Would you be up for that?
That is if Chuck invites her, Dr. Sneathen.
If I were invited, I would love to visit him there. I'd love to meet Chuck and his mother. They've taken him in, and I can't thank them enough for that.
So, Drakkar, would you want your grandmother to come visit you and Chuck? I understand that this is a big step for everyone.
I guess I could talk to Chuck and see what he thinks. I do miss my grandma, so it would be nice to see her a little bit more often.
Drakkar, please know that I would do anything for you. I didn't come after you because I wanted you to be happy.
Thanks, Grandma.
Well, it seems like we've made a lot of great improvements here. I'm happy with our progress. Would you be interested in coming to Drakkar's next session next Tuesday?
Oh, yes, I'll be here.
Okay, great. I'm happy with the steps that we made today. I hope both of you have a great week, and I'll see you both again next Tuesday.
Thank you. Have a great week.
Goodbye, Dr. Sneathen.
Our next and final scene shows the therapist and Timmy discussing his substance abuse problem. As mentioned earlier, he has an addiction to THC and opiates. It is important that this problem is addressed, especially if other medications are going to be prescribed to him.
Day 4.
Hi, Drakkar. It's nice to see you. How have you been? Are you okay? You look like you're shivering.
I've been okay, still a little down in the dumps lately, but I'm hoping things get better soon. I have a little package on the way, so that should help me out.
Well, that sounds interesting. What kind of package are we talking about?
I don't really want to talk about it.
Well, I'm here to talk, Drakkar. Everything between us is confidential, and anything you tell me about, I'm going to do my best to try to help you.
Well, my stomach's been hurting me a little bit lately. I've been having some of those Crohn's flare-ups. I went to my doctor and he prescribed me some medicine.
Opiates?
This is why I didn't want to talk about it. You're mad at me.
No, I'm glad you brought this up, Drakkar. This is something I've wanted to talk to you about for quite some time now. Remember when we discussed being on the clonidine to help you with the opiate withdrawal symptoms?
Yeah, well, what if I don't want to get off my meds? What if I'm still in pain?
I can understand your frustration and being scared of the pain, but remember what we talked about yesterday. These symptoms only last for about a week.
Yeah, well, I don't want to be in pain for a week. I want to be better now.
Okay, well, how about this? If you're able to maintain the abstinence from the opiates for about the next week, you can treat yourself with something. How about the Midwest Fur Fest convention instead of coming to our session that day? You can wear your full furry suit and everything, and I know you'll be really excited about that.
Really? I can go?
Absolutely, as long as you abstain from the opiates and stick to the clonidine to help you.
Yeah, definitely. I'm so excited. I'm going to Fur Fest.